Vitamin D is a unique fat-soluble vitamin because it can be produced by skin exposure to ultraviolet light. Thus, vitamin D is often called the sunshine vitamin. The most well-known function of vitamin D is its role in bone health. Vitamin D's bone health function is related to blood calcium and phosphorus regulation. These are both important minerals for strong bones. You need vitamin D to absorb calcium from the small intestine. Vitamin D also works with hormones to regulate calcium excretion via the kidney. And vitamin D affects calcium withdrawal from bones. So, all of these things together show vitamin D's importance in calcium regulation and in bone health. Now, in addition to calcium regulation and bone health, vitamin D has some other functions. One of those is vitamin D is important in cell differentiation. This is a process that tells a stem cell to become a specific cell, such as a skin cell or a colon cell. So the cells become different from each other. Now, in this function, vitamin D may actually reduce cancer risk by preventing mutations of cells. Vitamin D also helps support the immune system as it helps regulate the development of different immune cells. And research suggests that vitamin D may be important in preventing autoimmune diseases. With adequate vitamin D, about 30 to 40% of calcium is absorbed from the small intestine. But if vitamin D is deficient, calcium absorption dips to only 10 to 15%, and that means that there is not enough calcium available for bone health. If vitamin D deficiency happens in childhood, the deficiency disease is called rickets. And in rickets, the legs bow, the spine can curve, and there can even be skull malformations because we don't have sufficient calcium for bone development related to the vitamin D deficiency. The comparable disease in adults is called osteomalacia, which means soft bones. With all the different functions of vitamin D, it's important to get enough. And you can get enough vitamin D from sun exposure and food. So let's first look at sun exposure. Vitamin D is manufactured from cholesterol compounds in cells when your skin is exposed to sunlight. You only need about 10 to 20 minutes per day of your face and hands exposed to the sun to get vitamin D synthesis. However, if you live in north or south regions of the world, the angle of the sun from about November through March makes it so there is not a sufficient amount of vitamin D produced in those months. Also, wearing sunscreen can decrease vitamin D synthesis, but you should still use sunscreen to prevent the risk of skin cancer. Clothing covering your skin also reduces the production of vitamin D. And older people and people with dark skin need about 3 to 5 times more sun exposure, or about 30 to 50 minutes, to synthesize a sufficient amount of vitamin D. Now, one thing to know is you cannot get a vitamin D toxicity from sun. Dietary sources of vitamin D are important, especially when synthesis by the sun is limited in the winter months or for other reasons. There are only a few foods with natural vitamin D. These include fatty fish like salmon, fish liver oil, which is commonly called cod oil, egg yolks, and some mushrooms that, when they're exposed to sun, provide vitamin D. Your best sources of vitamin D are probably fortified foods. Fortified milk or plant-based beverages are great sources, and you can also find vitamin D in some fortified breakfast cereals and orange juice. Just check the label. Too much vitamin D can lead to excess calcium deposits in soft tissues, such as joints, your heart, blood vessels, lungs, and kidneys. Other symptoms of vitamin D toxicity include things like weakness, diarrhea, vomiting, loss of appetite, and even confusion. Now, excess vitamin D usually comes from supplement intake. It does not come from sun exposure, as the body regulates the amount made in the skin. And because there are not many sources of naturally occurring vitamin D in food, toxicity from foods is rare.